Okay, looks like we're kind of slowing down a little bit, and we will go ahead and get started. So, good afternoon. I'm Brennan McCutcheon. Stephen Barnes is the other gentleman that you can see on the screen. We're with Prime Capital Investment Advisors. If we work with you on the 401k or retirement plan capacity, you recognize us as QPA or Qualified Plan Advisor. So today we are in I guess it's the 8th or 9th of our education series of the year. We've got 2 more left this year that we will do, but today we're going to talk about Medicare and Social Security. So I will not do too much of the talking. Stephen Barnes, an advisor with our firm, will do most of the talking. I have long said this about Stephen, that Stephen is probably, I would put him up against anybody in the country in an advisory capacity in terms of his grasp and just the knowledge he has on Medicare and Social Security. He does a wonderful job. We put Stephen in front of our corporate clients, in front of our individual families and private clients that we work with, and just does a wonderful job kind of helping us navigate the waters of these 2 big government programs that we all rely on to retire. And so Stephen's got a great grasp on that. Today, kind of the rules of the road, I'm going to turn it over to him here in a minute, and we're going to go through probably, just guessing 45 minutes or so of a presentation. But before we get started, kind of the rules here are: you can use the chat feature, you can use the Q&A feature, type in your questions. We'll try to answer them live. And then at the end, we'll kind of open it up for Q&A. But we've done this enough to know that there's going to be a lot of questions. So when we're in the Social Security section, get your Social Security questions ready and type them in. Same thing on the Medicare front, and we'll get those answered. I will do the best I can to pose those to Stephen live so he can answer those for you. If there's something privately that we need to keep private and answer, then I'll just answer that offline. And then at the end of this, obviously you can reach out to either one of us and get some help individually. So we'll make sure you have all that content or contact information. So with that, I'll turn it over to Stephen. Stephen's been with us about 10 years, I think. Is that right, Stephen?
I think going on 12 now, yeah.
Okay, well, it's seems like 30, but so Stephen and I partner a lot and work together a lot. And so we're close friends and get to work a lot together. And I'm excited to have him on our team. We didn't know how fortunate we were when he walked in our door and joined our team. So with that, I'll turn it over. Stephen, if there's anything I forgot, feel free to drive and go ahead and take that lead.
Yeah, I appreciate that intro. And Brennan, you keep up with the chat for us, and you don't have to wait until the end. So we're going to stick around at the end of this, and we're going to stay until everyone's questions are answered. But you don't have to wait until the end. So if I'm going through something and you feel like there's something that you want me to touch on or elaborate on, go ahead and ask it there. And I'm just going to stop every few slides and let Brennan ask those questions. Another housekeeping item, we've had a lot of people email after the last one just for clarification. And, Brennan McCutcheon's an advisor. He's been with this firm, what now, 20 years, Brennan?
Yeah.
Going on 20 years. And I can assure you that this is Brennan McCutcheon. He's a financial advisor. We had a lot of emails asking, is that Brennan McCutcheon or is that the actor Patrick Dempsey from Grey's Anatomy? So I put these side by side here. It's very obvious that I see the resemblance. I know why these emails are coming in, but this is Brennan McCutcheon. This is not the actor Patrick Dempsey. And you would verify for us, right? Correct, Brennan?
Yeah, absolutely correct. Our bank accounts probably look a little bit different.
So we're going to start with Social Security. And the big question that Brennan and I get when we start these meetings is Social Security going to be there for me? And I think why that's a very viable question is if you look back to 1935, when Social Security was signed into law, it was a completely different program than it is now. Back then, people weren't living as long. The average life expectancy across both genders was 60 years old. So when people filed for benefits for each retiree that was drawing benefits, we had 160 people paying into the system to support that one retiree. So if you said, hey, could me and 160 people, could we support my mother and pay her Social Security benefits? We would say, yeah, we could probably do that. Fast forward to today, due to advances in healthcare, the life expectancy is not 60 years old anymore. It's 78 years old across both genders, which means that now we don't have 160 people paying in for each retiree. It's a 3-to-1 ratio of 3 taxpayers for each retiree. So I think when people say, hey, is Social Security going to be there for me? I think that's a very viable question. And the answer that Brennan and I usually come to an agreement on is yes, we do believe that it's going to be there for all of us. It's going to continue to be modified. We're probably going to have to see some combination of a reduction in benefits, working longer, and higher taxes. But yeah, Social Security is always going to be there. But what Brennan and I do is we're also going to factor into that financial plan and say, we may not count on Social Security being there like it is on your current statement. We're going to plan for modifications there. We're going to do a couple of giveaways today. So a lot of stuff that we cover is going to be in my book, Your Retirement Countdown. So if you Google Your Retirement Countdown, it's available on Amazon. If you just Google my name and Your Retirement Countdown, that is available on Amazon. And I'm going to send out a couple of free ones today. But we're not just going to give them away. You have to be the first person to correctly answer a trivia question. So that first question that we're going to ask for the first book giveaway is, now we mentioned Social Security was signed into law in 1935. Who was the president that signed that into law? So the first person that puts that answer into the chat, we're going to send you a free copy of Your Retirement Countdown.
Man, people are far more confident about this than I would be. Apparently I was the only one that didn't pay attention in class.
So look there and tell me FDR, Franklin D. Roosevelt, is the correct answer. Brennan, can you tell me the first person that put that in the chat?
I can't right now, but I will be able to go back and look at that. So yeah, it looks like people have a pretty good handle on when that was enacted and how that went. So pretty cool. Shockingly, no votes for Al Gore.
No, he invented the internet, not Social Security.
That's right. I forget.
All right. When it comes to your own Social Security check and this, how much Social Security is going to send you every month, is going to be based on a couple of different factors. The first thing that they're going to look at is what's called your earnings record. And your earnings record is actually something that you can look at online. You guys may remember they used to send us, I can remember being 19, 20 years old and Social Security used to mail this thing to me. I didn't even know how to look at it. I probably just threw it away back then. But we used to get Social Security statement every year. Now we only get those on certain milestone birthdays. And if you're taking notes, here's the first thing that I would write down. You can go to the Social Security website, which is ssa.gov. That stands for Social Security Administration.gov. And you can create what's called a MySSA account. And you can pull your earnings record. You can make sure that it's accurate. You can pull your Social Security statement. And it's going to tell you this is what your benefits estimated to be at 62, at full retirement age, at 70, et cetera. But how they're going to calculate your benefit, the first thing they're going to look at is your earnings record. So they're going to take the best 35 years, your highest earning 35 years. Some of those early years, they're going to index for inflation. So if I worked at Dairy Queen in 1982 and made $4 an hour, they're going to adjust that for today's dollars. But they're going to take those numbers and they're going to create what's called our base benefit amount. So that base benefit amount, what's also called primary insurance amount is the official name, is the first thing that they're going to base it on. And then the second thing is the timing, which we're going to get into in a few slides. When we actually file for benefits and we decide, hey, I'm retired, or hey, I've decided that I want to start working and drawing benefits, there are a few different benefits that we may qualify for. The first is what Social Security calls our retired worker benefit. Our retired worker benefit, that simply means, hey, it's me, it's Stephen, I'm retired. I want to draw these benefits based off of my own work history. A spousal benefit means I'm going to be drawn off of my spouse, or my spouse is going to be drawing off of me. So to give you a breakdown of spousal benefit is typically going to be half of whatever the higher spouse earns. So let's say that Candace and I, my wife, Candace and I are retired. Her benefit is $2,000 and my benefit is $800. Then I could apply for a spousal benefit off of her and get $1,000 a month. Now, we used to get really cute and really creative in the way that we did this Social Security planning, and we would say, I'm going to file for my spousal benefit now. I'm going to let my own benefit grow. Then I'm going to switch benefits, and we could get really creative. That changed about 8 years ago. So now Social Security has what's called deemed filing. So deemed filing means when I file for benefits, I'm deemed to have filed for every benefit that I've applied for. So how that comes into effect, let's go back to the spousal benefit. And let's say that Candace's benefit again is $2,000 and my benefit is $800. They're going to look at both of those benefits and say, oh, well, your spousal benefit of $1,000 is higher than your own benefit. We're going to send you a spousal benefit. In that same scenario, if Candace's benefit is $2,000 a month, but mine is $1,200, then I'm not going to qualify for a spousal benefit because my own benefit is higher than what my spousal benefit would have been. And then finally, we have a survivor benefit. Survivor benefit is simply if the high wage earner, if the high benefit earner passes away and predeceases you, then you take over that benefit in the form of a survivor benefit. So from a planning perspective, how we look at survivor benefits, and I'll have this happen at least 2 or 3 times a year. Someone will come into my office and they'll say, hey, Stephen, I know that we've went to your webinar, we've done some planning, and it makes sense for me to draw benefits at 66 or 67 when I retire, but I want to draw benefits now at 62 because I've been diagnosed with some new things. I'm taking more medications. Neither of my parents live very long, so I just don't think that I'm going to live long enough for it to make sense for me to wait to draw Social Security. In that instance, we'll say that's true, but your wife is 10 years younger than you, and she just ran a marathon yesterday. So when we're planning and we're looking at the complete financial picture, what we want to look at is not only if I reduce my benefits and I draw at a certain time, am I locking in my own Social Security benefits for the rest of my lifetime? But if I predecease my spouse, I could be permanently affecting my spouse's benefits as well.
We do have a question that popped up about, a previous spouse.
Okay.
And so, was married 20 plus years, then divorced, remarried, and was married only 1 year before he passed away. Both are kind of in the same, both spouses were in the same income range. The lady made significantly less than both of her spouses. What would claiming Social Security look like, right, in that instance generally?
Right. So let's cover all of those because that kind of ties into this next couple of slides. So a couple of rules about spousal benefits. The first is that both you and your spouse have to be 62 years old to draw spousal benefits. So if Candace is drawing that $2,000 now and she's 62 and I'm only 54, I can't get my $1,000 right now because I'm not old enough. The second rule, and this is something that also changed when they changed the rules back in 2015, is your spouse has to have already filed for benefits. So if Candace is still working, she's still growing her benefit, so she hasn't applied for that $2,000 yet, but I want to get my $1,000 spousal benefit off of her record, I first have to convince her that it's a good idea for her to apply for benefits. So both spouses have to apply for benefits. Now, I'll say this caveat: if you or your spouse was born on or before December 31st of 1953, or if you're a widow or widower, there are additional strategies available. So if you'd like information on either one of those, if you or your spouse was born 1953 or sooner, you may be grandfathered into some of those other rules. Just send me an email and say, hey, Stephen, we're born on that date. Send me some information on some of those grandfathered rules. Or if you're a widow or widower, and I can send you some information on widows' benefits as well. So to answer the question about divorce spousal benefits, you can also draw off of a previous spouse, but there are a couple of rules. Some of them are similar, some are different. The first rule about spousal benefits, number one, you have to be single. So I used to say you can't have remarried, but that's not actually true. Like the person that asked that question, we may have several marriages that qualify, meaning that we were married for at least 10 years, which is how long you have to be married to draw off of an ex-spouse. So it's like an all-you-can-eat buffet. You just pick out who made the most money that you were married to for 10 years or more. Just like the regular spousal benefits, you both have to be 62 years old if you want to draw off of an ex-spouse, or an ex-spouse wants to draw off of you. If you've been divorced for over 2 years, they don't have to be drawing benefits, because I think what Social Security probably knows is somebody would not draw benefits just to kind of spite an ex-spouse. And again, you have to have been married 10 years. So I always tell everyone, if you've been married to a rich lady for 9 years or more, just hold on. There's a pot of gold at the end of that rainbow if you can stay married for 10 years. And I believe that, and check this, because this is I'll Google this, and or Brendan, if you can Google it and verify that I'm going to answer this one question is correct. But I believe that if you were married at the time that your spouse passed away, I believe that time is 2 years. But just like the regular benefits, when you file for benefits, what you want to make sure that Social Security knows is that they recognize that any marriages that you had for 10 years or more, and then it's going to be deemed filing again. They're going to look at your own benefit, and they're going to look at your ex-spousal benefit off of any previous qualifying marriages, and they're just going to send you which one was highest. So never mind about the Googling.
Got it. I do have a little bit more broad question, but it not necessarily to do with spousal, but we've got somebody that's got a question that says they're here, worked on a green card in the United States before becoming a naturalized citizen, worked all along. Are Social Security benefits calculated any differently as a green card holder compared to those as a citizen?
No, they're not. But when you actually go to receive benefits, and we're going to get towards the fringe of my knowledge here, but I do know that if you're working on a green card, they're going to calculate your benefits the same. But then if you ultimately have credits for a pension from your home country, if you remain a citizen there and you're drawing some kind of retirement benefit from their system, that there could be some type of offset. So that's one of those that I would have to pull out the regulation and look at, because I just don't do it really often. But broadly answering, yes, they're going to calculate your taxes and your benefit from working on a green card just as they would if you're a citizen.
Okay, good. Awesome questions. Thanks for that one that was pretty specific there. So I appreciate that. And as we kind of go on through this and you have other questions, continue those coming, but also know that on the backside of this, one of the reasons that we do this is to help folks from a planning and retirement projection standpoint. And so that is a key part, right, of your retirement picture, whether it be Social Security benefits, like the person that asked the question about a spouse that had passed away, or a divorce that was in the picture, or also the green card question. So keep in mind that reach out to us after this is over, and maybe set up some time we can meet one-on-one, and then we can roll up our sleeves and dig into that specific situation that are a little bit more case specific. So love the questions. Keep them coming.
Yeah. So we had another question. Clarify one more time. My mom has passed away. My dad is drawing Social Security on his own record. Can he draw off of my mom that is deceased, or is it either his or hers? So it is either his or hers if he's already drawing. Now, with some of the widow or widow's benefits, there are some 2.0 level, 301 level. There's some information on widow or widower's benefits that I could send to you. But for the most part, what's going to happen is you're going to draw a survivor's benefit, and they're going to send you the higher. So I would say that what the situation most likely is your dad's benefit was higher than your mom's. So that's why he's still drawing his own benefit. He's not drawing your mom's check as a spousal benefit. Good questions. Now, you guys probably know the earliest that you can file for benefits is 62 years old. For retirement benefits, for most of us, is going to be 67. They've been working on feathering the full retirement age and full benefits from 66 to 67. And then if you wait until age 70 or beyond, you can get what are called delayed retirement credits, or what I call bonus points, if you delay benefits past your full retirement age. So this chart, and you know what's really, people are so much more educated on Social Security. And I don't know if you've noticed this as well, Brennan, but when we first started doing these workshops and offering this service 10 years ago, when I first came on with you guys, there was so much that people didn't know. You know, they didn't know what their full retirement age is. We would pull this up. I would say now in most meetings, we'll meet with someone and they'll say, you know, my retirement age is 66 and 4 months. They know exactly when their retirement age is now. So I feel like our industry, and maybe it's this, you guys jumping on these webinars with Brennan and I, if we want to take a little credit, but it seems like more people on this webinar probably know this than you would have 5 or 6 years ago. But if you don't know, your full retirement age is based on the year that you were born. And if you look at this chart, it's going to illustrate your full retirement age. These next few slides in the deck, in my opinion, are the most helpful thing that we'll go over today. And this simply illustrates the benefits and the detriments of when you time your Social Security. And before we even get into that, the one thing that I want to make sure that I'm clear on is that what I'm not going to say to anyone, and certainly not make any blanket statements, is you need to wait until full retirement age, or you need to wait until 70, or you need to draw at 62. Every single person's financial plan, financial situation is going to be different. So what's going to be good for one person, it may completely make sense to draw benefits at 63. And then the next person that Brennan and I meet with, it may make sense for them to wait until age 70 or beyond. So there's really no be all end all for the best age to draw, but these next charts illustrate the effect that timing does have. So if you were born between 1943 and 1954, remember the first thing Social Security is going to do is they're going to look at your earnings record. They're going to look at the best 35 years that you ever worked. They're going to run that through their formula, and they're going to create what's called your primary insurance amount. They're going to determine that base benefit. And then the second thing that affects this is the timing. So let's say they look at my best 35 years. It's determined that my base benefit is $1,000 a month. So if I was born in 1953, and my base benefit is $1,000 a month, if I draw at age 66, they're going to send me $1,000 a month. I can wait as long as age 70 and get $1,320 a month. I can draw as early as age 62 and be reduced down to $750 a month. And then if we look, what's happened is, if I was born in 1955, now it's not 66 anymore. It's 66 and 2 months before I can get 100% of my benefit. It's 70 and 2 months before I max out. And then if you look at that other 62, now I'm not getting 75% of my base benefit at 62. Now I'm getting 74.2%. So the later that we were born, we have to work a little bit longer to get 100% of our primary insurance amount. We have to work a little bit longer to max it out. And then we're hit a little bit harder. We're affected a little bit more for drawing early, all the way until we get for folks that were born 1960 or later, like myself. Now 67 is our full retirement age. 71 is the length that we need to work, or excuse me, the length that we need to wait to draw benefits to get the maximum amount. And 62, now we're reduced to 70%.
So a couple questions came in on that, Stephen. One, and this may answer them both, but one is, when you start drawing Social Security, is it locked in at that percentage? For instance, if I'm born in 1960 in the slide I'm looking at, and I start drawing at 64, am I locked in at that percentage?
Yes, you are. I'll add the caveat that you're going to get cost of living adjustments based on inflation. But your base benefit, the amount that you draw, is going to be locked in at that 80%. So what a lot of people say is, well, can I draw at 64, get 80%, and then reapply when I get full retirement age and then get the full amount? And the answer to that is no, or we would all do that.
And then the next question, similar, or at least in that vein, is, if I start drawing Social Security at 62 and return to work, and they keep some benefits for me making too much in that year, does that increase my amount that I draw, since they're taking back sometimes as much as my Social Security amount is?
Right. So part of that is going to be a couple of slides down the road. Yep. But yes, if we go to work, if we go back to work and we go over some of these earnings caps that we'll talk about in a few slides, and they withhold benefits, it's going to be like we never drew those benefits. Another question that came in, and I'm going to kind of reword this a little bit, but if I turn 64 and I don't draw benefits, but then a few months pass by, do I now need to wait until my next birthday, or I've missed out on benefits? So Social Security actually prorates these on a monthly basis. So if you were born in 1960 and you're 62, if you look at that difference between 62 and 63 is 5%. So they'll take that 5% and divide it by 12 months. So for each month that you delay benefits, you actually get around a 0.5% bump in pay for each month that you wait. So you don't have to apply on your exact birthday to make sure that you're not, missing out on any kind of raise or anything like that.
And then one more question before we move on too far, just for some clarification about Social Security. Says, my husband is now 67 and receiving Social Security, but I'm still working and not sure if I need to sign up for Social Security or not. I'm 63, going to be 64 this year. And can he draw on my Social Security also? And so let me say this first. When we're trying to figure out whether we need to take your Social Security in addition to what's going on with your husband, Stephen and I are both going to answer that in the realm of that's a broader retirement planning decision, right? It's not necessarily a decision to be made solely in this silo of Social Security. That's just a broader discussion on overall planning and what the other financial puzzle pieces may look like with you guys. So we may sit down with 10 couples, and 5 of them we may answer yes, we want them taking it right early at 63, 64 based on some variables. And then the other 5 or 6 folks, we may say, no, we want them to wait. So that one, again, that's more of a let's look at the rest of your financial puzzle pieces on that. But then secondly, the question there is, can he draw also on her Social Security?
Mm-hmm. Well, he can. Couple of rules. You would have to be drawing benefits first. And we're going to talk about, because you're not full retirement age yet. If you're 63, you're going to be 64 this year. So you're not yet full retirement age. So there are a couple of things that we're going to talk about in a couple of slides that will clarify that. And then if you were drawing benefits, again, when your husband, he's 67 and he applies for benefits, the only way that he's going to be able to draw off of you is if half of your benefit is more than all of his. So if you've made roughly, twice the earnings that he has, to simplify that, then yes, he may be able to draw a spousal benefit. And we're happy to jump on the phone with you as well. So if you want to send me an email and say, hey, let's schedule a 5 or 10 minute call, I can ask you a few additional questions and we can work that out. Another question, can we calculate our benefits? You can calculate your benefits. Social Security has some calculators online that you can put in your salary. The easiest way to do it, I think this person said I came in late. You can go to the Social Security website, that's ssa.gov, and you can create an account. You can log in there and you can pull your statement, and they'll tell you what your benefits will be.
Yep. And then lastly, will my benefits go up if I start at 62, or is this the wage that I'll receive until the day I die? And that is, you are going to receive cost of living adjustments, right, throughout time. So more recently, and maybe famously, the last couple of years with inflation being so hot, the Social Security Administration has given pretty sizable cost of living adjustments, somewhere between 6 and even 8-9% the last couple of years. So those numbers have been going up. Of course, the reason they're going up is because a loaf of bread's also going up that much too. So technically, those benefits should continue to go up with cost of living adjustments, but you can't hop from a 62 number to all the way, now I'm gotten older, I'm 67, now I want my full retirement benefit. You are locked in when you chose to pull the trigger on those benefits. All right.
And this dovetails right into that last question. What if I work and get benefits? And what's completely changed over the last 30 to 40 years is people don't always do like my grandfather did. My grandfather worked for one company. He retired at his retirement age. They gave him a gold watch and a pension. What we see more and more often is people are working past 65, they're working past 67, or people are retiring early at 62 and they're kind of cobbling together retirement that says, you know what, I'm not willing or I'm not able to work 40 hours a week anymore, but I'm also not ready to work 0 hours a week and not do anything at all. So maybe we want to look at some kind of retirement that involves, I'm drawing some money from Social Security. I'm drawing some money from my 401k. I'm drawing money from my IRA, and I'm doing some part-time work. So what Social Security has said is, if you're not full retirement age, if you're not yet 66 or 67 or 66 and a half, whatever your full retirement age is, if you're not full retirement age and you want to start drawing benefits, what we don't want people doing, and this is Social Security talking, not me, what Social Security doesn't want people doing is they're willing, they're able to work, they're making a salary of $100,000 a year, and they're drawing benefits out of the Social Security trust just because they want to. So Social Security and the government just in general, they use a lot of carrots and they use a lot of sticks. So the stick that Social Security uses is they're going to say, if you're not yet full retirement age and you want to keep working, we're going to limit the amount of earnings that you can have in a year to $21,240. And for every $2 in earnings that you go over that, we're going to take $1 out of your Social Security benefits. Now, to answer an earlier question, if they end up taking benefits out of your check, they're going to recalculate your total benefit and pretend that you just weren't drawing for that portion. So you may get a little bit of raise in the future. But they're going to put that earnings cap on just to ensure that, hey, if I'm 62 years old and I'm making $70,000 a year, we're not just going to send you a Social Security check just because you want to. Now, a question that you're probably going to ask is what counts towards that $21,240? So it's not all of your taxable income that counts towards that $21,240. So IRA distributions don't count. If I'm taking money out of a 401k, that doesn't count. If I sold a house and made some money, that doesn't count. The only thing that counts towards that $21,240 are salary, wages, and tips. So money that I make for my labor.
Another question came in here right quick. I retired at age 62, but went back to work at age 68. I'm now 73 and still working. They do take Social Security out of my check. Will my retirement amount ever go up?
It could. That depends. So this is what frustrates people. Probably the most thing that people just tell me, wow, I'm going to paraphrase here, that they say, wow, that really frustrates me. They voice it in different ways and phrase it in different ways. But the summary is, wow, that frustrates me, is that after we draw Social Security benefits, if we're still working, we still pay FICA taxes. They're still taking Social Security out of our paycheck each time. So what happens is now they're relooking at my best 35 years. So if I'm drawing benefits and I'm still working and paying Social Security taxes, if this is one of my best 35 years, that could potentially raise my average. And now they're going to recalculate my benefits because what's called my average indexed monthly earnings have went up. So although you may still be paying Social Security benefits, taxes, it could potentially increase your benefits. Do we have another one come in, Brennan?
No, I got it.
Okay, good deal. So when we're talking about income and we're drawing Social Security benefits, so the three things that I want you to remember regarding your income, if you want to draw Social Security benefits, the first thing that I want to remind you of is that you are not penalized for income after you reach your full retirement age. So if I can throw an 80-yard perfect spiral and I haven't signed a contract with the Dallas Cowboys because I don't want to mess up my Social Security check, after I turn 66 and a half or 67 or whatever my full retirement age is, I can earn as much money as I want to. They're not going to penalize me for income after I reach my full retirement age. The second thing that I want to remind you of is that you're not penalized for income after you reach your full retirement age. And then the last thing that I would want to remind you of is you are not penalized for income after you reach your full retirement age. So hopefully that gets the point across, because that's one thing that people walk out of the room and they remember. I remember Stephen told me, I remember Brennan told me that there was a limit on how much money that I could make if I was drawing Social Security benefits. But the first thing that we forget is that doesn't apply when we reach full retirement age. So that's why I say it 3, 4, 5, 6, 7, a dozen times.
And remember that full retirement age is different for all of us, right? It's different based upon your birth year, right? So some of us it's 65, some of us it's 66 and some months, some of us it's age 67. And so that's what Social Security classifies is full retirement age, and when that income restriction, if you will, of simultaneously drawing Social Security is null and void.
Yeah. Good points. Social Security taxation, I'm not going to go in depth on in this webinar, simply because it can get really complex. It can be confusing, and I want to make sure that I'm doing more to help you than I am to harm you, or more to confuse you. So what I'll tell you in this 101 level class is that up to 85% of your Social Security benefits may be taxable based on your income in retirement. So some people pay taxes on none of their Social Security benefits. Some people pay taxes on 85% of the benefits, and some people are in between. Now, that doesn't mean I'm paying an 85% tax rate. That doesn't mean I get a $1,000 check and 850 of it goes to the IRS. What that means is the absolute worst case scenario is on a $1,000 Social Security check, 850 counts as ordinary income, and 15% of that is tax-free. Now, everyone that registered for this webinar, and I have an email address, I'm going to put you on a pre-retirement course that I'm going to email out to you every couple of weeks. You'll get a new little module over the course of the next year or so. And one of those modules is going to be over Social Security taxation, and it's going to go more in depth on how that formula is calculated, what counts. And if you're closer, if you're within, hey, I'm 6 months out from retirement, I'm a year out, and we really need to start doing some income planning, one thing that Brennan and I, or Travis, or Jason, or Jonathan, or Heath, or any of the advisors that we work with you guys to help plan for retirement, one thing that we're going to look at is how your income affects your Social Security taxation, et cetera. You have a couple more come in, Brennan?
Yeah, one that we can go ahead and answer now. If you've not already discussed this, please do so. What is your forecast for Social Security to even exist 10 or 20 years into the future? So
yeah,
I'll let you take that one.
Yeah, so that was one of the first things. Glad to revisit it, because I think it's important. So, I think that, and I've heard Brennan say this independently of me, and I've said it independently of him. So I think that we agree with this: is no president, no Congress wants to be the entity, the political party that has to handle this tough situation. So what we've done for the past 30 years is we've just continued to kick this can down the road. So we have another 12 years or so that the Social Security Trust is completely viable. I believe that what's going to happen, because there are really only a few levers that you can pull. You can reduce benefits. You can have people work longer. So if you look, a decade or two ago, when Social Security changed the full retirement age from 66 to 67, I could completely see that going from 66 to 69 or 66 to 70. So I think that we're probably going to see another round of we have to wait longer to get benefits. I think that there could be some type of reduction in benefits, and I think that there could be an increase in taxes, and most likely what we would see is an increase of all three of those to keep the Social Security Trust viable. Brennan, you're pretty sharp. What would you add to that? Would you agree with that?
I typically have a magic 8-ball in my office somewhere, but I don't know where it's at. I really do. Yeah, no, I think there's a couple things being discussed right now. None of them are overly popular. There's what's called a means test that basically says that if you're judged to have the means to do without some or all of your Social Security, then that may be, something that they would do. That's a lot like healthcare, right? In the sense of we're going to make it income based. Folks that make more money pay more. Folks that make less money pay less. So you can imagine that's widely unpopular. But I think in the grand scheme of things, I think Stephen's right in terms of like it's I believe it's going to be there. I think the surefire way to never get elected is to start messing with that. So it's kind of this grenade that every president has like said, oh my gosh, okay, that didn't go off in my lap. So here, now you take it. And they're going to continue to hand that down. Eventually they'll address it. And I do think when they do, it's going to be a reduction of benefits, and it's going to be a lengthening of time. You're already starting to see Congress do this in terms of the required minimum distributions that we have for our IRAs and 401ks, right? So used to be when we were in the Secure Act, they changed the required minimum distribution age up from 70 and a half, the age at which we had to start taking money out of our retirement so that we would pay tax on it. They bumped that to age 72. And then the Secure Act 2.0 bumped it to 73, and they're going to pave the way over the next 10 years for all of that to come to age 75 is now the ceiling to where we have to take money out of our IRA accounts. All of that is kind of, under the guise of we're getting older, right? Life expectancy. So to me, I kind of see that as a big foreshadowing of, hey, remember we gave you these benefits of we're living longer, so you get to keep your money in your IRAs longer so that we don't tax it. Oh, by the way, we're living longer, therefore working or retirement age should be longer than age 67. So I could see that, right, being bumped up to age 70, 72. And that really has some synergy with what they've done in the RMD space already. So I think it's a little bit of just, hey, we gave you some benefit over here on this side of it. Now we're gonna bump the ages, to this. So a couple quick questions before we move on to Medicare. Are IRA distributions factored into your income when it comes to Social Security taxation?
Yep, they are.
And so, yes, those IRA distributions do count. And then I will answer this next one maybe later at the end of the entire rodeo. It's about a little bit more retirement planning in general. So we'll talk through that.
From a tax perspective, and we're going to talk about Medicare premiums as well, but when our advisors, when we do retirement planning and income planning, one thing that we want to drill down on is when we're looking at IRA distributions, 401k distributions, we want to make sure that the last $1,000 that we're taking out of our IRA doesn't cost us $1,500 in Social Security taxes and doesn't cost us $3,000 in Medicare premium. So that's one thing that we always want to take a look on, is to make sure that we're just being efficient with any types of distributions. I have had it the case that we've sat down and learned that someone was paying $3,000 a year in Medicare premiums. We were able to throttle down some IRA distributions and really break them even. So that's a really good question. So we're going to go through, I got a little bit behind schedule, which is good.
Yeah, we're good.
A lot of good questions. So I'm going to go through Medicare 101 a little bit faster. You guys probably know Medicare is health insurance for people that are 65 years or older. If you've had federal disability for 2 years, they'll send you a Medicare card. If you have Lou Gehrig's disease or end-stage renal, they'll also send you a Medicare card day one. So Medicare was signed into law in the 1960s. It was really simple. They had Medicare Part A to cover if you were admitted to the hospital. They had Medicare Part B for outpatient medical. In 2003, George W. Bush signed the Medicare Modernization Act. They signed 2 new parts of Medicare into law: Medicare Part C, also known as Medicare Advantage, and Medicare Part D, Medicare Prescription Drug Program. So we're going to send out another book. Brendan, did you ever find out who got the last FDR question right?
No, I can't until we end the thing.
Okay, so we'll find it at the end. Ooh,
Yep.
that'll be a pleasant surprise for someone. So we're talking about Medicare being signed into law. Same question, only now we're talking about Medicare. Who was the president that signed Medicare into law?
little more diversity here. Gosh, I want to have a drink with whoever said Kanye, because I just like that person.
Are you gonna? Well, you know who answered that. Will you get those results, Brendan?
Yeah, I should be able to see it.
So I'm going to send a book to the person that says in the chat, the first person that said LBJ. And I'm also going to send a book to the person that said that Kanye West signed Medicare into law. So yeah, most of you guys knew LBJ was the president that signed Medicare into law in the 60s. JFK tried really hard to do it. He just he wasn't able to quite survive long enough to do it. So LBJ ended up signing that into law. We've got someone with their hand up, Brennan.
Oh. All right. Robert, coming to you. If you have a microphone, I'm going to try to do that. All right, Robert, we're ready.
Hey, no, I'm sorry. I don't need that. Sorry about that.
All right, all good.
Good. So for most people, your Medicare Part A inpatient hospitalization, you don't have to pay a premium for that. That's covered by all of the payroll taxes that you or your spouse paid during their working career. If you're admitted to the hospital, they take your clothes, they give you a gown room and a wristband for anything other than overnight observation. You're covered under Part A. Medicare Part A is going to have a $1,600 deductible. The good part about that deductible is it covers you for 60 days. The bad part is that you pay that day one. So 1 day stay, 60-day stay, same price under original Medicare, same cost. We hardly ever see stays over 60 days. If you do have one of those, there's a $400 per day copay. If that stay extends past 90 days, that sucker doubles, and it is $800 per day. Part A also covers skilled nursing care. The best way that I can describe skilled nursing care, and my mom worked in one of these SNF units when I was a kid, is it's kind of in between the hospital and the nursing home. So they're saying, we can't keep you admitted in the hospital, can't really send you home. Don't want to send you to a nursing home. We're going to try to get you better in this type of, maybe it's an inpatient rehab type facility. If you're in that type of facility, Medicare is going to cover the first 20 days at no cost. Medicare is going to pick up 100% of that tab. For days 21 through 100, there's a copay per day of $200. After 100 days, you don't have to go home, but you can't stay there. Medicare is not going to cover more than 100 days of skilled nursing care. And I'll also point out Medicare does not cover custodial care or long-term care. So if I'm in a nursing home, assisted living, I have someone come into the house to help me cook, clean, get in and out of bed, brush my teeth, etc. Medicare is not going to cover that. We have to have a separate policy, or we have to self-pay for that.
Quick question: Are the premiums and the per day stuff that you're talking about, are they continuous days or are they per year?
It's per benefit period. So it's per a 3-month benefit period. So if I go in for days 1 through 60 and I'm in 10 days and then they let me go home, and then a couple of weeks later, I'm admitted for the same thing, then it goes back to that, now I'm on day 13 or whatever. If I've been out for a few months, now I'm starting a new benefit period and we're starting all over and have to pay another deductible. Good question. Part B, as we mentioned, Part A does not have a premium. Part B, we do have to pay for. Part B is based on our tax return. It's based on our earnings. So the base premium that most people pay for Medicare Part B is $164.90 a month. If I'm an individual, I file by myself, I'm single, and I'm making $97,000 or less, that's what I'm going to pay for my Medicare Part B, is that $164.90. Or if I'm married and I'm making $194,000 or less. Once I go over $97,000 or $194,000, if I'm married, our Medicare Part B premiums, they start to go up. You'll see all the way up to, if I'm making over $750,000 as a married couple and I'm not paying $165 for Medicare anymore, now it's costing me $560. So a scenario that Brennan and I run into all of the time is we're helping someone, we're making this transition into retirement, and they're saying, hey, I got this notice that said I had to pay $329 for my Medicare Part B premiums, but I'm not making $280,000 anymore that I'm retired. Now my income's $70,000. So what do I do? Well, if you do nothing, what's going to happen is the IRS and Social Security communicate, and they go back 2 years on your tax return. So if you don't do anything at all, it takes 2 years for Social Security, Medicare, and the IRS to get on the same page and charge you the correct premium. or there's a form that Brendan and I can do for you, that Travis and I, Jason and I, Heath and I can do for you, that we can say, hey, we've had a life-changing event. We're not making this much money anymore. This is what we're making now. And they'll get that fixed for you. That's a pretty easy thing. I'm batting, over the last 17 years that I've been doing this, I can't think of a single one that I'm not batting 1,000 on when we submit the paperwork correctly and timely. Medicare Part B is your outpatient medical. So again, if they take your clothes, give you a gown, a room, and a wristband, you've been admitted, you're covered under Part A. Most stuff we're not staying overnight in the hospital. So we're going to be covered under Medicare Part B. So outpatient medical, think of things like doctor's visits, specialists, x-rays, lab services, things of that nature. For outpatient services, we're going to pay the first $226 a year in the form of an annual deductible. So that doesn't mean, hey, every time I go to the doctor, I've got to pay $226. That means that at the first of the year, I have to pay that. After that, Medicare is going to pick up. They're going to pay 80%. And then I've got 20% coinsurance. And if we think about it, 20% of a doctor's visit, specialist visit, and x-ray, that's not really bad. But then when we think of some things that are done on an outpatient basis that can be really expensive, chemotherapy, radiation are all done on an outpatient basis. Brennan and I had a client at one time that was going through some pretty severe medical issues, some very expensive treatments, and she shared with us, and you probably remember being in this room, Brennan, that every time they hooked an IV bag up to her, the cost of that IV bag was $80,000. And there's no cap to that 20%, which is why I recommend that everyone, if you don't have access to teachers' retirement, police retirement, civil service, something of that nature that they're providing for you in retirement, a secondary policy after Medicare, I recommend that almost everyone take out a Medicare supplement policy. Medicare supplement policy is a private insurance policy that they're help pick up the Medicare out-of-pocket expenses. So they're there for the 20% coinsurance, the $1,600 hospital deductible, the $400 per day copay, the skilled nursing out-of-pocket, things of that nature.
Quick question. If somebody's full retirement age is 67 and they retire at 65, can they get on Medicare at 65, or do they have to wait until their full retirement age? So maybe talk just a little bit about the differences there.
Yeah. So
good question.
Yeah, good question. So a lot of it's going to depend on, how do I sign up for Medicare? So if you're already drawing Social Security benefits, and I don't think that was your case, but Medicare is going to decide that if I'm already drawing Social Security benefits, I must be retired, and they're going to automatically send me a Medicare card with parts A and B on it. Now, let's say that I'm drawing Social Security benefits, but I'm not ready to pay $165 or maybe more for that Medicare Part B. At that time, I can turn my Medicare card over and I can opt out of Part B.
And
I think in your scenario,
more simply put, is there is a distinct difference between Medicare eligibility age and Social Security full retirement age, right? So everyone's Medicare eligibility age, unless you are disabled, is age 65, regardless of birth year. On the Social Security side, we're going to be somewhere between ages 65 and 67 right now. So, but one doesn't have to do with the other. And so plenty of folks are drawing Social Security past on their full retirement age, but choose to continue to work, right? And then we also have folks that are on Medicare at 65 and that they choose to not draw Social Security to get the delayed or credits or the bonus points that Stephen was talking about earlier, but they're not connected in any way.
Right. So I think what confuses a lot of people, if we get back to the Medicare supplement option, and if you've taken a sick day from work and you've watched The Price is Right or Judge Judy or anything like that, you've seen commercials or you've had something, if you're 65 years old, you've already had your mailbox inundated by ads for Medicare Advantage plans, which are different than Medicare supplement plans. A Medicare Advantage plan are provided by private insurance companies, just like Medicare supplement policies. But unlike Medicare supplement policies that are secondary after Medicare, Medicare Advantage plans replace your government-issued Medicare services with the private insurance company. So Typically, these plans are going to provide a lot of extra benefits. They're going to provide things like dental, vision, rides to the hospital, things of that nature. But the trade-off for that is now I may have to use plan doctors, hospitals, providers that are in their network or will agree to accept their conditions. I may be required to get a referral to see a specialist. I may need a prior authorization before I can get certain services. If you're not yet 65 or you're not yet on Medicare, you're going to have an opportunity. Someone's going to pitch one of these to you. Here's what I always recommend. If you compare staying on original Medicare and taking out a Medicare supplement, and you compare that to a Medicare Advantage plan, and you think that you want a Medicare Advantage plan, before you make that final decision, call your Medicare providers and say, hey, I'm thinking of joining this certain plan. What's your opinion? Do you guys accept it? Have you had a good experience with them? And make sure that your providers are on board so you don't get any billing type situations with them. And what makes that confusing is that those same companies that offer the Medicare Advantage plans also do Medicare Part D. These are also offered through private insurance companies. And again, this is something that if you don't have teachers' retirement, police, civil service, firemen, some type of retiree prescription drug insurance, for most of us, the only prescription coverage that's available is Medicare Part D. There's a lot to it, but here's what makes Medicare Part D plans really easy. And if you're already on Medicare, or maybe you're helping your parents with some of this stuff, there's this thing called the Medicare Plan Finder. You can go to medicare.gov, enter in a list of your medications, enter in your pharmacy, and it's going to help you shop for all of the plans that are available and make it pretty easy.
So, and I know folks have to drop off when we're coming up against 1 o'clock, and that's totally fine if you need to drop off. But we've got this recorded, so we'll continue and we'll stick around as long as you guys have questions. So don't feel antsy about needing to leave. If you need to leave, take off. One question, Stephen, can you kind of address maybe the confusion we hear a lot around you have to sign up for Medicare when you hit 65 or you're going to lose it. So address that, because we hear that a lot, and I think people are maybe misinformed or scared about that.
Yeah, it is. And Social Security actually even sends some people a letter. It's really unique size. Like if you take a piece of printer paper and fold it in half, it's a weird shaped letter that Social Security sends out. And it basically says you may have to sign up for Medicare. What we find, and especially because we're 401k advisors, which means that typically the people that we're working with have employee benefits. So as long as you have coverage through your employer, as long as you have coverage through your employer and that employer has more than 20 employees, then that means that your employer coverage, you can remain on that past age 65. Your employer coverage is still going to be the primary payer. And if you had Medicare, it would be the secondary coverage. So what we typically find is that most people, when we compare the cost of employer coverage to Medicare, the employer coverage we find more value in. So I would say 75 to 85% of the folks that we work here with at Prime Capital ultimately end up delaying Medicare Part B because we don't want to pay that premium when we turn 65. And then you can pick up Medicare Part B whenever you retire, whether that's 66 or 67 or 75 or whenever that is. And there's paperwork that we can do in coordination with your human resources department to make sure that Medicare and Social Security know that you had that coverage in place and they don't give you any penalties or anything like that. Good question.
Here's a question that I'm really just more excited than anything to hear you answer. So is there a particular Medicare supplement policy that you recommend? How would you answer that question?
I find that when we go through the process, what people typically see are what's called Plan G, what's called Plan N, and what's called a high deductible Plan G. With Plan G being the most expensive, the high deductible Plan G being the most inexpensive, and then Plan N kind of being in the middle. all have their benefits. I don't recommend plan N very often, because I find it's the kind of a combination of, I feel like I'm still paying a lot of money for it, but I'm still paying out of pocket as well. A high deductible plan, we're going to pay less for each month, but we're going to have more out of pocket cost. What I find is that when we go through all of the options, when we're transitioning someone into retirement and we're helping looking at these policies, most people decide that they like a plan G.
Way to tap dance. Good job.
Yeah, I forgot my hat.
Yeah. So just to reiterate here, somebody says, so going back to you have to get Medicare when you turn 65 or you'll lose it. So we do not have to sign up when we reach 65, that age, so long as we have insurance in place.
Yeah, so long as it's creditable primary coverage. Now, where I want to make sure that no one gets mixed up on this webinar is if we have anyone on this webinar that you're working for a company that has less than 20 employees, then at that point, Medicare is willing to say, we're going to step in and be the primary payer. So if you have coverage that's offered through a small employer, meaning less than 20 employees, we need to review and we need to talk to your HR people. And if that's the case, we may need to sign up for Medicare when you turn 65. And that goes back to dovetails perfectly into the next slide, the timing issues that we want to look at. If you have coverage through your employer and there's a large employer, there's no penalty if you want to delay Medicare. Review your options 3 months before you turn 65. So sit down with me, sit down with someone that does what I do and say, here are the medications that I'm taking. Here are the doctors that I'm seeing. Here's what I'm paying for my coverage through work. Here's what my out-of-pocket is. Let's compare that to Medicare and see what makes sense. And then do that again 3 months before I retire, because then at that point, I don't have the option to stay on my group coverage anymore. So really 3 months before we turn 65, 3 months before we retire are perfect times to sit down and say, let's start making this transition plan and making sure that we're not getting behind any 8 balls and that we're just staying on track. We're not making any wrong decisions or missing anything that we need to be keeping track of. What questions do we have? So that's the main material.
Yeah, one thing I would add, and this is kind of wrapping up a question that was really our first question before we started this whole thing. And well, before I read that, let me read this one that just popped up. Does credible coverage also apply if your retired spouse is on your company's group plan?
Yeah, absolutely it does. So if let's say that I'm 63, Candace is 65, she's on my coverage, she can delay Medicare as well because she has creditable coverage through my employment. Yeah, we do that all the time.
So the question that came up earlier was how do I use my 401k in retirement, right? Like 401ks we know are designed to be able to accumulate dollars, and we put these dollars into them. And if we're lucky, we work for a company that has 401k match and they match that as well. But how do I actually use it at the end? And so one of the things that I think we need to think of is how everything fits together, right? And so we want to try to, if you've joined our Medicare and retirement planning and estate planning sessions before, you've heard me say this. One of the things that we want to get out of the habit of is feeling like there's some like loophole, or there's some like, booby trap that we're about to fall into, that the government's out to get us. And if we don't do this thing just right, we're just toast for the next 30 years. And so I've got to really squeeze every ounce of blood out of the turnip that I can from Social Security. And the same thing from Medicare. What we would rather you come to this conclusion, that it's all about how the whole thing fits together. And so what may be the best approach is not how can I just absolutely max out one government program or the other, but rather how can I use all of the financial tools at my disposal that I've saved and that I've worked for over all these years. How can I use those to work in concert with one another the most effective and efficient way? to squeeze every ounce out of that. That's the most important thing that I think that we would want our clients to know or to be reminded of, is it's not about nailing it from a Social Security standpoint and making sure that, okay, I'm gonna choose to take it at 62 because, if I would have to live another 12.6 years to make the break even. It's really more about, like, we can't answer that question until we know what the rest of the financial picture looks like for you. So the question originally was, how does the 401k fit into all this? And in the 401k plan, if we do it right, we save money, we have all this money in this bucket when we retire, and then we're no longer working, right? We've shut off the income spigot. And so now we have to go reach in that bucket every month, and we have to pull out a certain amount of money to put with our Social Security and any other pensions or rental incomes or whatever we may have to make ends meet and to live the lifestyle that we want to live in retirement. And so, theoretically, you could take all of your money out of your 401k. From a cash flow standpoint, that might not be the wisest thing. You can take, if you got $500,000 in your 401k, you can take it all out day one and go throw a huge party. And that'd be a lot of fun.
Yeah.
You're not going to be penalized for that. But the penalty, I guess, is going to be for the next 30 years when you don't have any money, right? And so we want to make sure that we are doing the planning piece of this, which is the most important, that informs why and how and when we're taking our distributions and withdrawals from our 401k plan. Same thing on the Medicare and on the Social Security. The why, the how, and the when is informed by the big picture, not a single sheet of paper sent to me by Social Security that says, here are my options, pick one. And so I think that's important for us to all be reminded of, is there's not this, one box that we have to check to get it right. But there's rather a whole picture that we need to look at to get it right for you and your family, right? Because if Stephen and I are planning for our own families, Shelly and I may choose something completely different than what Stephen and Candace choose, but it's because some of our other financial puzzle pieces are different, right? And so it's not one's bad and one's good. It's just that they're different in terms of looking at the whole picture.
We don't have the budget for hair care products.
Yeah, right. So yeah, you don't need as much. Got it. My hair catches so much flack, and I just really don't know why. Okay, questions. Anything else? We have got a total of 37 questions that we've answered. So that's pretty cool. Somebody asked, please put your contact info back up, please. They can do that. Thank you, Jerry. They are jealous of my hair. So contact information.
That is true, Jerry.
Another thing that I will put. Oh, sorry, Bryn. Of course it is. Bryn's the one that's got long hair. I've also got in the chat feature in the chat section, our website. And so all of our advisors' contact information is in our website. You can book an appointment. You can look at our calendars. If you don't like me, but you do like Stephen, you can sit down with Stephen and schedule some time for him. That would make you in the majority, which is totally fine. So you can check that out. So I'm going to post our website again, and that'll take you, if you look at our teams section, you can get mug shots of every one of us, read a little bio, and book an appointment, send us an email, give us a phone call, whatever you need if you have specific questions. So Stephen's contact information is on the screen as well if you need that. So I hope this was helpful. We've got a few more people popping in, but they're just kind of good jobs and high fives. So guys, we appreciate it. And I hope you join us next time. We've got coming up next month, be on the lookout. I believe it is estate planning. Jason Gerber will be doing estate planning coming up. And then we've also got our team. Some of our analysts are going to be putting on a kind of a making sense of markets coming up. I actually think that's coming up next week. So be on the lookout in my emails. We will have that for you guys to join. There's obviously a lot to be talking about in terms of the investing environment and the markets. And then estate planning is certainly something that almost everybody thinks, dadgummit, I need to be thinking about that. Wills, trusts, powers of attorney, healthcare directives, stuff like that. So all of us need to be reminded of that. All right. So y'all have a good day. And don't forget, we can watch the recording if we need. All right. Bye, guys.